Gulnar Sagiyeva was a beacon of hope for countless families in Kazakhstan. Her presence in the community was not just as a healthcare provider, but as a symbol of unwavering support and compassion. As a neonatal nurse, she dedicated her life to caring for the most vulnerable newborns. Each day, she would walk into the neonatal intensive care unit with a heart full of love and a mind focused on providing the best care possible. Her gentle touch and unwavering compassion brought comfort to both infants and their parents. She was often seen soothing crying babies and reassuring anxious parents, her presence a balm to their worries. Gulnar was known for her unwavering commitment to her patients, always going the extra mile to ensure their well-being. Whether it was staying late to monitor a critical case or offering a shoulder to cry on, she was always there. Her colleagues admired her dedication, and her presence brought a sense of warmth to the neonatal unit. They often spoke of her as the heart of the team, someone who could lift spirits even on the toughest days. Gulnar's personal life was just as fulfilling. She balanced her demanding career with a rich and loving personal life, finding joy in the simple moments spent with her loved ones. She had a loving family and a wide circle of friends. Her home was often filled with laughter and warmth, a testament to the love she both gave and received. Life was good, and she felt incredibly blessed. Every day she counted her blessings, grateful for the love and support that surrounded her. Little did she know that a storm was brewing within her, a silent struggle that would soon turn her world upside down. The signs were subtle at first, but they grew louder with each passing day. The dedicated nurse, the loving friend, the devoted mother, would soon face a battle she never anticipated. It was a challenge that tested her strength and resilience in ways she had never imagined. This battle was not fought with medicine or medical instruments, it was a fight for her own mental well-being. She sought help, knowing that to care for others, she first had to care for herself. Life took an unexpected turn when Gulnar experienced a mental health crisis. It was a moment that changed everything, a sudden and jarring shift from the life she once knew. This unforeseen event shook her to her core, leaving her feeling lost and vulnerable. The emotional turmoil was unlike anything she'd ever faced before. The once vibrant and caring nurse found herself struggling to cope with the overwhelming challenges of her condition. Her days, once filled with purpose and compassion, now felt heavy and insurmountable. The stigma surrounding mental health in her community made it even harder to reach out for help. She felt the weight of judgment and misunderstanding from those around her. Fear and shame became constant companions as she retreated from the life she once knew. The isolation was suffocating, and she felt trapped in her own mind. The crisis had a profound impact on Gulnar's life, leading to a long-term stay in a psychiatric institution. The sterile walls and unfamiliar faces became her new reality. She was stripped of her legal capacity, losing the right to make decisions about her own life. It was a devastating blow to her sense of autonomy and self-worth. Her independence, once a source of pride, was shattered. She often found herself reminiscing about the past, longing for the days when she felt in control. The days turned into weeks, and the weeks into months, each one blurring into the next. Time seemed to stand still, yet move relentlessly forward, leaving her in a state of perpetual limbo. The hospital walls felt like a prison, confining her to a life she never imagined for herself. The sense of confinement was both physical and emotional, a constant reminder of her altered reality. Even in the depths of her struggle, Gulnar's spirit refused to be extinguished. She faced each day with a quiet determination, finding strength in the smallest of victories. She found solace in her innate desire to care for others. This compassion became her guiding light, a beacon that led her through the darkest moments. She organized knitting classes for her fellow patients, her nimble fingers transforming yarn into intricate patterns and shared moments of connection. These classes became a sanctuary, a place where worries could be momentarily set aside. The rhythmic clicking of knitting needles filled the silence of the ward, offering a sense of purpose and accomplishment. Each stitch was a testament to their resilience, a small but significant act of creation. Gulnar's love for music also found a way to bloom even in the sterile environment of the institution. She would often lose herself in melodies, finding peace and joy in the notes that danced through the air. She rallied her fellow patients to organize concerts, their voices blending together in a chorus of resilience. These musical gatherings became a source of strength, a reminder that they were not alone in their journey. These small acts of creativity and compassion became lifelines, not only for Gulnar, but for those around her as well. They fostered a sense of community, a network of support that was vital for their emotional well-being. They served as a powerful reminder that even in the darkest of times, the human spirit has an unyielding capacity for hope and connection. Through shared experiences and mutual support, they discovered that light could indeed be found in the most unexpected places. A ray of hope emerged when Gulnar was introduced to the Training Cafe project, a community-based initiative that empowered individuals with mental health conditions to regain their independence and self-worth. The cafe provided a safe and supportive environment for participants to learn valuable vocational skills. For Gulnar, it was a chance to step outside the confines of the institution and reclaim a sense of normalcy. The aroma of freshly brewed coffee, the clatter of dishes, and the murmur of conversations filled Gulnar with a renewed sense of purpose. She thrived in the structured environment, her confidence blossoming with each passing day. The cafe became her sanctuary, a place where her past didn't define her and her future was filled with possibilities. It was a testament to the transformative power of inclusive, community-based initiatives in supporting mental health recovery.